about the wait times in the ER. It's a big issue in New York City. As you can see in the picture, one of the biggest issues is overcrowding. Good. Okay, so these are the average times in New York City hospital emergency rooms. As you can see, nothing is less than an hour, and that's from the time that the patient walks into the emergency room and checks in. So once you check in, before you even are triaged, that's what the patients are saying that they're waiting. This is according to patient satisfaction surveys. So this is pretty accurate. Go ahead. Okay, so there are two examples there are many examples, but these are two recent examples of deaths caused by long waits in emergency rooms in New York City. One is in the Bronx and one is in Brooklyn, Kings County Hospital. The first one is a young man, a 30-year-old man. He walked into the emergency room for something plain, something simple, a rash. He started with a rash. He had a simple complaint. He was there for only 8 hours. 8 hours until he died. He died, okay? No one realized that he was dead in between that time. So he passed before that 8 hours. But because of the overcrowding and the understaffed in emergency rooms, 8 hours is what took for them to find his body. Okay? So now we have a 49-year-old woman. She checked into Kings County Hospital into the psych emergency room. So not your average emergency room, but it's no different. She sat there for over 24 hours. She was actually sitting, there's actually a video, but I wasn't gonna play it. She was actually, I don't know if you guys can see, she was sitting here. This is her body here in the corner here. She was sitting in that chair, she walked in fine. A small, simple complaint. She sat there, she looked fine. The staff walked by her, she was sitting there. There were other patients that watched her. She toppled over, fell on her face. No one said or did anything. Security, on the video shows that security watched her. They came over around the corner, they actually watched her on the floor in distress, did nothing. They came around, took 24 hours for them to go over, kick her body, and say that she was dead. But again, it's understaffed and no one to go and check if she passed away. Not just anyone can label someone as dead. It has to be a PA or a doctor to say that. Go ahead. Okay. So these are some ways that hospital staff, I don't know if anyone works in the medical field here, but hospital staff can shorten the emergency room wait times. So they can stop the practice of boarding patients, which is triaging patients that don't have emergencies. If you don't have urgent care reasons to be in an emergency room, then don't go to the emergency room. If it's something that your primary care physician can take care of, then you shouldn't be in the emergency room. They can practice they can register patients at the bedside. So if they get the patient to the bed and get a doctor to start seeing them and then take their information, that patient's already in that bed, they're not waiting already. Again, like I said, they can redirect them to outside care, the minor needs. When they collect labs, they can rush it. The technology, and of course, more staff. Okay. Now, these are things that, again, you can do as a patient going into the emergency room. If you don't have emergency reasons, then just rethink before you go into the emergency room to go into the emergency room, make sure that you label your reasons and get to the point, okay? And you check in as soon